that are here in attendance, and if you're on your way, you better get here soon. There's coming pizza, or you don't want it to go cold. But for those of you that are online watching too, we hope that you get some good information tonight. My name is Jessie Rogers. I'm the Prevention Program Director at Henck Family Services. And we just wanted to put together a night of resources and information from our community partners in regards to substance use, and especially with our youth. We have a prevention program where we specifically try to reduce youth access and use of drugs and alcohol. And so this is one of the ways that we try to do that, is by providing education to our community members. And so I'm not going to take up too much time at first. I'll come back and talk about some more resources and information later. But one other thing I did want to just mention is that we are heading into what we call National Red Ribbon Week, which is just a week where same thing, we're trying to reduce youth access and use of drugs and alcohol, and by providing education for our youth across the communities. And so the theme this year is Life is a Puzzle, Solving Drug-Free. And so look at this, we have all of our puzzle pieces here on stage tonight at our community partners that are going to tell us about some of the things that are going on. So if you wouldn't mind passing this all the way down.
Thank you guys for being here. We appreciate it. My name is Deputy Ayala. This is my partner, Deputy Dave. We're assigned to the Twin Peaks Sheriff Station. We are coming here to talk to you guys a little bit about what we're seeing in terms of narcotic use, in the mountains. The biggest things that we're noticing this year specifically is methamphetamine. We do have fentanyl use, but it's not as much as it was last year. Ways that we're trying to counter, the use of, those types of narcotics is being proactive, going out in the community, and then your guys' help. That's what's important. You guys see something, say something, right? Kind of all this working together, to counter, these things get into, children's hands. So,
like my partner said, based off of last year to this year, what him and I have noticed is that, one, the usage of narcotics on the mountain has actually gone down a lot, significantly. And part of that is due to our community partners that have reached out, letting us know when they see something, but also, again, going back to that idea of us being proactive. So when you see us out there, if we're out there, wave us down, let us know, because that's what we're here to do. I don't know if you guys know, for those of you that are locals, Sheriff's Department, we don't really give tickets. That's not our field of view, but we love going in there and helping out the community, finding the drugs as they're coming out of the mountain, because that's our big issue. The way the kids get their hands on it, the way our community members get their hands on it, it's coming up that hill. We don't really have a big problem with manufacturing here on the mountain, but it's the distribution. So as those drugs are coming up the mountain, that's what we're trying to catch. That's what we need your guys' help to do, is help catch those in the moment. But I know you have some other speakers tonight. They're going to talk about some of the other ways that we can help in the moment, like the Narcan. I know we have a community member around here, someone that's going to talk about that. I can just speak from personal experience. If you can get it, have it on you. It's so helpful. Teach your kids what it is, how to use it. Don't be afraid to have those hard conversations with your kids and with your family about narcotics, about these things that are affecting our community in a real and tangible way. So with that, obviously, we're here to help out.
Have you checked Facebook if they're still or
on the
not?
back table, because unfortunately we're not able to stay for the whole session. So feel free to take a photo of our cards in the back. And then just one quick thing that I want to touch on: if you're going to have those conversations with your kids, I do want to let you know that there is not particularly on the mountain, but in the county, we have noticed that there's these fake fentanyl pills. So they're pills that are designed to look like candy or look like other legal drugs or legal things like Tylenol, but they're laced with fentanyl, and one of those pills can actually cause significant damage. We can have people overdosing. That's that crisis that we see in the nation of people that overdose on their first try. So having those conversations before this is ever initiated is key, and making sure that your kids and that your family knows that they can reach out and have that conversation judgment-free. I've had that conversation with my kids and my partner. We have those conversations regularly with our family to let them know that if you see these things, you're not in trouble, but that we're here to help and we want to reach out for that. So I hope it's okay. Since we have a couple minutes before we have to get out, if you guys have any questions, we're open to it. We'll be in the back, but otherwise, if you need anything, we have our cards on that back table. like I said, that's totally cool. If something comes up later, or if you guys have a question, you can always phone the station or reach out to us on our business cards, because I understand as you're having these conversations with your family, as your kids start asking more questions, you're probably gonna have questions too. Yes?
How can we get, children that are in trouble or gonna get in trouble to go through, the program where we train them, do the presentation with them as part of their, education to get them, more educated on, how Narcan works and fentanyl and drugs and all of that? How can Family Services get involved with the law enforcement to help educate the children?
Yeah, that's a great question. Just how Family Services can help with law enforcement as far as education of our community and specifically our children. I think, to be honest, what I've seen in my experience is it always is going to start at home, because a lot of the time these students or these community members, they don't really want to go and reach out to us first. They don't want to reach out to these massive services until they have those conversations at home. But with regards to Family Services teaming up with the Twin Peaks station, I'd be really interested. I can get my admin started. We can see what we can do about that and maybe put together something in the future. We do have probation. They're not super active up here, but I can get with them too if that's something. Anyone else? Yes.
So is your advice essentially to tell like a kid to, when it comes to pills, that you don't get it from a doctor or a pharmacy, like don't take it, essentially with the risk of OD?
Yeah, absolutely. So when it comes to the kids, again, this is what I just told my family, is that if mom and dad are giving you the pill, that's okay. Because obviously if we're gonna be giving them something, it's gonna come from the pharmacy. It's gonna be something that we know is safe for them to use. And just explaining the danger in that is that if it's not coming from mom or dad, what could that look like? If it's not coming from your doctor, what could happen with that? Because, and I wish I had brought it, but we got caught up on call. But there's actually a graph that I'd love to bring around next time, but it just shows how these Tylenol pills, children's Tylenol, it can look so similar to these other pills that are laced with fentanyl. So yeah, having those conversations like that, letting them know if it's not coming from a trusted source like a doctor, mom, dad, guardian, then just don't touch it.
I have a question. So are you actually out on the field? How is it that you're noticing that these drugs are coming from, down below? How is it you're pinpointing that?
Yeah, absolutely.
So just gonna touch base on what we talked about last time on how we're figuring out these things, right? It's just being out there and being proactive, right? A lot of us are out there, traffic stops, talking to people that we see walking. A lot of times, right, we can tell, who, is from the mountain, right? And those people that come up and down the hill, they kind of stand out, right? So we talk to those people, hey, what are you doing up here? You visiting? A lot of times they'll talk to us and we can see, right? We're not new to this. So when we talk to people, a lot of times they get nervous. They'll say, yeah, I'm down the hill or visiting somebody. Okay, well, where are you going? And a lot of times they can't answer it, right? So it's just raising those suspicions. So the biggest thing is for us getting out there, asking those questions, finding these things, right? Seeing where they're coming from. A lot of times, like I said, it's downhill. A lot of times from San Bernardino, right? They come up here, they try to, target, people that are right here, and those people, don't make good decisions. So we find out. We talk to those people as well. There's a lot of people up here that we do talk to that are frequent flyers for these kinds of things, and they'll tell us, right? They'll tell us where these things are coming from. So that's where we're getting out there and talking to people, and it's problem is it's coming from down here and up here. So our biggest thing is we're trying to limit that as much as possible, show our presence with the star around. And then, like I said, having you guys, right? You guys see something, your kids say anything, family members do something that doesn't look right, you guys give us a call, because then it helps us. We can get out and make those contacts. We have a reason to go talk to these people, right? Because now the community's going to call for service, right? So we have that reason to be there and try to figure out what's going on.
Thank you.
Yes, sir.
Is there a prevalence for an age group that you're seeing this with?
In terms of
The usage or kind of reception of these laced?
Yeah, so the primary demographic, at least here on the mountain, that's using these narcotics is going to be adults, right? And the reality of it is, and again, my partner and I were talking about it prior to coming up here, is that We actually haven't had like a overdose in a long time on this mountain, at least as it relates to fentanyl. I'd like to say that, that we had something to do with that our Protections Bureau had something to do with it, our partners at CHP who also help relay information back and forth with us. So primarily the demographic is going to be our adults, right? The worry is the kids. Thankfully, at least this year, I think I can speak for my partner and I, we haven't had any overdoses amongst our youth. But it is something to worry about. What I've noticed, at least down the hill throughout the county, not necessarily in this area, it's going to be that junior high school age. That's when they're kind of experimenting, where they're maybe getting peer pressure from their peers at school, from their peers in the community, maybe people getting wrapped up in gangs or any type of gang situation. That's the demographic, kind of junior high through high school. If it's going to be the youth. Thankfully, here on the mountain, we haven't had that issue. On the mountain, it's going to be primarily our adults. Well, thank you guys so much. Again, I'm sorry that we have to leave so early, but again, if you have any questions, feel free to reach out. We have our cards in the back, and you can always contact the Twin Peaks station, okay? You guys have a good night.
Hello, everybody. My name is Corinne Mara. I am the sales representative with Congressman Jay Overmont's office. And if I can kind of just piggyback and make sure that being here, but I just had this conversation with my kids, and I have it with them usually 2 to 3 times a year, always throughout this time. And as they get older, the questions change with my daughter and my son, who are 17 and 14. We're like, how are our kids, overdosing from fentanyl? Just a little bit until you tell me that. And so I'm like, well, you know what? It's because they think they're taking something, but that's not what it is. And so the conversations with your kids are always important, and not just once, but you have to have the conversations over. Because they're always like, Mom, we know you tell us all the time. And I'm like, you don't know how many parents we meet that say they told their kids, and we wouldn't do our jobs if we don't continue to remind them. And as they get older, their questions change, or maybe they see things. So having those conversations in the household is really, really important and really key, and also maybe they can tell their friends. So it's really important in my opinion. But I do want to mention, as far as the congressman's office, he has met multiple parents, unfortunately, who have lost kids to fentanyl. And being that our district is very rural, and there's a lot of illicit fentanyl that comes into our district, he has met a lot of family members who have lost their children or family members to fentanyl. And if you talk to him about it, he'll always recall a mother who lost 2 boys at the same time to the same thing. And that story kind of always stuck with him, heartbreak from the mother, and so he does advocate a lot for federal legislation just to give our local agencies, our law enforcement officers, our DA agencies the tools that they need to really prosecute and try to fight this in the legal system. So we did have the Halt Fentanyl Act, which is something that the congressman has introduced in every single one of his terms as the congressman. And we are very pleased to say that this year, in his third term, it has been signed into law. So it passed the House, it wouldn't pass the Senate, so we never got it signed into law, but this year we really did. And this would change the fentanyl to a Schedule I drug. So that would be to really go and target after the traffickers and the drug providers who are really, selling this, knowing that this drug is in there, and killing a lot of people in our district. So the congressman was very happy to finally see this piece of legislation signed into law. Another legislation that was introduced is the Support Act. This was actually original from 2018. This provides funding for resources for treatment, resources for education, substance misuse prevention, treatment, recovery kind of programs, and it was going to end. So they reauthorized that this year to be able to continue providing those resources so our communities can have that available, and go ahead and make sure that we're still continuing to fight that on the home front, and being able to provide some of those resources for our community members and their families. And a new legislation that was also introduced this year was the Chinese Fentanyl Act. We know that a lot of the fentanyl that comes over is, it's not like pharmaceutical fentanyl, this is illicit fentanyl. And so it's always very clear that we know that it's coming, over our borders, across the seas, smuggling in, and that's why it's extremely
And I didn't know that until after I kind of got off the operating table. They're like, you might want to be a little careful when you go home and give you some fentanyl. I'm like, well, I prevent that. That's my job. So, but apparently it does have medical surgical uses and things like that, so it can be legit. But when it is produced by an illicit lab or something, I have a video that we show out in the community that shows the tip of a sharpened pencil with just a few flakes on there, and they say that's enough to cause a fatal overdose. So I can't even imagine somebody trying to regulate that when they're producing the drug or when they're ingesting the drug, especially if it looks like something else, like the deputies told us. It's pretty scary. I miss going out trick-or-treating house to house when I was a kid. I used to love that, but now, yikes, can you imagine? You never know what you're going to get. We've got Raquel over here. Not to put anyone on the spot, but she's one of our health workers that goes out into the community and presents a beautiful presentation about fentanyl and other opioids, okay? It's not just about fentanyl, but it's also about any kind of drug that somebody takes that's opioid-based, like painkillers, Vicodin, things like that. And one thing we have noticed on the mountains that was new to me when I started this position, I was about fentanyl bad. Fentanyl, it's like illicit street drugs and stuff like that. Turns out that sometimes elderly folks and less elderly folks sometimes forget if they took their meds or not, and then they might think, gee, I wonder if I took my pills, so they'll take it again. And sometimes that results in an overdose. And the thing we hand out, naloxone, which you might have heard referred to as Narcan, that's the most popular kind of brand name for it. It'll reverse that overdose in a matter of 30 seconds to 2 minutes, and it can save someone's life. Okay? So that's what we do. If you know anyone who needs their staff trained or needs themselves trained, we'll even go to a house and do a small group of people, and we basically show them what it's all about. And the difference between other naloxone or Narcan, you may have seen it at, say, Rite Aid, or, well, not anymore, I guess, with the Rite Aid. And CVS, or somewhere, they may have it available. 96, that's right, we switched over to. It's my favorite pharmacy. But wherever you go, sometimes they will provide Narcan, and now I'm most sensitive to it. I'll see the name, Narcan, I know about that, but then it usually has a price tag on it, and they'll charge you like $45, or some places even more, I guess. Ours is free. So if you ever need any Narcan, please come to Rim Family Services, and we will hook you up, as the kids say nowadays. But yeah, we'll set you up good, and it doesn't cost you a thing. And we're just here to try and help save lives, basically. Okay? And that's about all I've got to say about that. I'll pass it on to Mr. Starr over here, my favorite hospital supervisor.
Hello. I'm Nick Starr, and I'm a hospital supervisor at Mountain Community Hospital. My job is to manage the day-to-day operations of the entire hospital, but I'm an ER nurse by trade. I grew up here. I don't think I've been to MPH since 8th grade, and it smells exactly the same. Yeah, it is very nostalgic being here. I'm happy to be here. And I'm a parent of a 6th grader, so this is important to me personally. I dug into our records, and over the last year, I gathered some information. And like our wonderful sheriff's deputies were saying, opioid overdoses are really good up here, honestly. We've had 0 pediatric opioid cases in the ER in the last year. I'm going to give you the 1, 2, and 3 of the drug-related hospital visits that we see in pediatric patients. Number 1 is marijuana. Marijuana is legal now for adults to consume, and parents aren't always great about keeping it away from their kids. That's the big one. 2 is alcohol, and 3, strangely enough, is hallucinogens. Those are the trends that we're seeing. A little more on Narcan. We also provide Narcan at the hospital, and it's free. You can ask for it, and there's no, you're not going to take your name down or anything. You just give it to you. An important thing to note about giving Narcan to somebody who you believe is, the influence of opiates is you also need to call 911. Yeah, right? Yeah. Narcan's half-life is about 2 hours. It can be a little bit less than that, or naloxone, which is basically the time that it takes for half of that substance to be eliminated, by your body. It takes 4 to 5 half-lives for something to be entirely eliminated. Fentanyl, which is kind of the shortest half-life opiate, is 2 to 4 hours. So usually when people are overdosing on opiates, they usually want this. So it's important to call 911. Yeah, like I said, we have Narcan and MCH, so yeah, come by and get it, or get it from these guys. Trends that we see in the adult population in our ER are, like the sheriffs were saying, methamphetamine is the big one right now. The good thing about methamphetamine is statistically people start using it about 20%. Our youth are relatively safe from that drug. Another one that we are starting to see more of is kratom. Kratom is a natural, plant-derived substance that acts in a very similar way to opiates. Narcan actually works on kratom, or on kratom overdoses. So kratom is an interesting thing because it's technically legal in a lot of states. It can be bought in some shops. It's something to look out for and to discuss with your children. You see them with weird little bottles of, maybe it's an energy drink, check the contents and make sure. A little about Mountains Community Hospital. I'm sure a lot of you have been to our hospital. But we are, attempting to drive with a renewed vigor to engage with community. We have a new mission that says we are trying to be the, healthcare beacon. And so part of that is we're developing more community resources for all of us. One thing that we already have is we already have mental health service in the Rural Health Clinic. I left some pamphlets over there for it. A lot of times, maybe first time drug use is fueled by peer pressure in the youth. But continuous drug use in the youth is often a symptom of some other struggle. And so, if that's going on, we have there's a lot of education that we're planning in this coming year. Some of this is specifically geared towards children, and some of this is, general community members. Some of that is home emergency preparedness. We're going to have at the hospital a lunch and learn. We're going to have a safe sitter babysitting course here and at RIM. Teen mental health and coping strategies also here and at RIM. Some are safety and hydration here, and family first aid and safety. So that is upcoming. If you want to know what we're up to, please follow us on Instagram or Facebook, and let us know what we can do to help you.
Well, thank you all so much for being here tonight. We really appreciate it. I just wanted to share some of the resources as RIM Family Services, and through RIM Family Services, we also have what's called RIM Communities for Youth Coalition. Being that we are federally funded in the way of lobbying for any kind of bills or anything like that, we can't technically do that. And so we work through coalitions, which are community members that basically we come together and we try and find ways to prevent the access and use of drugs and alcohol. And then if that means going to county board of supervisors or whatever that looks like, especially within our unincorporated area, that is our goal and our mission. And so if you are interested in joining the coalition, you can always email rcfycoalition@rimfamily.org. rimfamilyservices.org with your information. We'll add you to our email list. We meet the second Tuesday of every month from noon to 1 online. So you could be in your pajamas at home and join us and feel like you are helping the cause of preventing substance use within our community. And then to kind of piggyback on what they were talking about in regards to opioids or medication, sometimes kids, they get into the medicine cabinet and they pull out those things and they don't know what they're taking and they bring it to a party and they put it in a bowl. And I've heard where kids will just grab it and you have no clue what they're taking. And it's extremely dangerous. And so we highly encourage, if you do have young children or even especially teenagers in your home, to lock up, especially opioids or any kind of medication that you may have. And then if you have medication that you're not using anymore, we also distribute what are called in-mart bags. So there are bags that you can put that medication in, it's already pre-postage, you can send that off and they'll take care of it and dispose of it properly. We did have the medication drop boxes in 2 locations on this side of the mountains, but unfortunately that program has discontinued. So if you are trying to go to the sheriff's station or the Running Springs Fire Department, at those boxes, they are no longer in existence. So we highly encourage you guys to come stop by our family services or see us out at some of the amazing community events where we're tabling at, and you can grab one of those bags there as well. In addition, we have information for sharps containers. So if you have sharps that you need to get rid of, we can show you how to access that as well. Also, for parents, we do have a handout here that talks about just some online resources that you can connect with. There's one called Use Common Sense. It's media that's a trusted resource for parents to learn about safety tips and guides regarding social media, gaming, books, TV, and movies. While some resources are offered at a nominal charge, many on the site are free and offer deep insight to ensure your child's safety. We all know that everybody walks around like this, right? We're going to have little humps on the back of our neck from the time we get older because we're constantly looking down at our phones. And that is also an addiction. It releases that dopamine, and every time a kid goes online and they're playing games, that is an addiction as well. And so we want to make sure that as parents, you have resources to make sure that what we are doing online is safe. Safe from other people, safe from images and things that they might see, and safe from access to these substances. Unfortunately, we had, a young man who lost his life here in our community, and that's who we do our game of skate for every year for Dante. And he went on, I think it was Snapchat, and he got Percocet or something, and he took half the pill, and that's what took his life. There's this whole analogy that they use in regards to fentanyl, where it's kind of like when you're baking, right? And you're baking chocolate chip cookies, and you throw all your chocolate chip cookies in the batter, and then you make the little balls of the cookies. Well, one cookie can have 5 chocolate chips, and the other one can only have 3. And that's kind of the same thing that goes with these illicit pills, these counterfeit pills. It's like these people that are making them, they're not measuring out everything that's in it. So one pill could have all fentanyl, whereas the other could only have a little bit. And so you're truly gambling with your life. And again, like we said, or like we've all talked about, having these conversations with your kids is so important. One of the other resources that we have is Talk, They Hear You. This one is specific for alcohol, but it's a really cool app that you can put on your phone that almost gives you kind of a step-by-step conversation with your student. And so the flyers are over there on the table. They look like this. And so you download the app, and then you get to go. It's almost like you're playing a video game. It's kind of fun. But they have different scenarios and things that maybe your student might say, or your child might say, and then that you can counteract. And they teach you different ways that you can talk to your students specifically about alcohol. And I would imagine that you can flip that and use it for any substance, really. As we're talking about marijuana and the different things. Rim Family Services recently just got a new tobacco prevention contract where we're going to be working on tobacco retail license in the city of Big Bear Lake, and then expand that out to the county as well. And so the hope for that is that in some of these smoke shops, we can help curb the fact that they're selling some of these things that they should not be selling, whether that's meth pipes, whether that's flavored tobacco. If you didn't know, flavored tobacco is illegal, and they should not be selling that. They should not be selling to minors. And so these are some of the things as a coalition, as Rim Family Services, we're trying to help prevent. And what's great that you as community members, you that are online even, can help be a part of the solution. You know, we sit back and we're little keyboard warriors all the time on that social media, but what are we really doing to help stop this? And these are the steps that we can take. One of the other things I wanted to point out as well that we do have over on the table is this emoji decoded. This was put out by the DEA, also with the campaign of one pill can kill when we're talking about fentanyl, because the idea of one pill could potentially kill you, and it's very scary. But this decoded thing basically gives kind of like a little example of different types of emojis that students might be using. So if you are monitoring your student's phone and their text messages and everything like that, then you can look and see at some of these emojis and how maybe they fit together and who they're talking to, and they might be looking for substances, unfortunately. Also, what I would suggest, check every single app on their phones. There are apps that are calculators that are actually messaging apps. So they look like it's a calculator, but really it's a messaging app where who knows who they're messaging. And there are so many predators out there that are looking for our students and our kids, and we need to protect them from that. And that's okay as a parent to not be their friend for a moment, and to step in and say, no, I need to protect you, and so I'm going to have these conversations with you. I'm going to look at your phone when it's necessary. And then again, just encouraging y'all to be a part of the coalition if you can. Again, that's the second Tuesday of every month, online, we meet via Zoom. And so again, you can email me or email the coalition, rcfycoalition@rimfamilyservices.org. And then, yeah, take advantage of the resources that we have. One other plug I'm going to do is that as we are funded by the county, a big way that we get funded is by collecting data, so surveys, in other words. And so that kind of helps us too to know what the community is seeing, so that we're not just assuming there's a problem, but yet we're actually hearing from all of you in the community. And the data that we get from these surveys helps us with how we do our campaigns, how we do our education, and then again, helps with our funding as well. And so if you have a moment in the evening and you could go and scan a QR code, or if you like to do the paper surveys, we would really appreciate that. And then for those of you that are watching online, you can go onto our Facebook pages. We have the RIM Communities for Youth Facebook page, and then we also have RIM Family Services, and so we'll be sure to put those surveys up there as well. And I think that's all I have to share. So are there any questions? Yes.
For those watching and for those in attendance, we talk about that it's very important when there's an overdose situation to call 911. There are some people that may turn the other cheek because perhaps they're afraid. If there's a group of people at a party and they know that there's consumption of fentanyl or whatever's causing that overdose, can you please explain the Good Samaritan law?
The Good Samaritan law basically makes someone who helps in an emergency situation not liable for any of their actions, while they're helping. So if you help somebody, or you attempt to help somebody, maybe even do it the wrong way, you are covered. You cannot be held liable.
Thank you.
So help people.
I know that's very common, especially with youth at parties and stuff like that, because they're always afraid they're going to get in trouble. But you want to save your friend's life over getting in trouble, I would imagine. And that Good Samaritan law is in place for those kind of situations. Any other questions?
What was the name of that drug that you said it started with a C?
It starts with a K, Kratom. Yeah.
What form is that? Is it a liquid, a pill?
So the forms that we have seen are, it seems very common to be in almost like a 5-hour energy, kind of like it's like a really small bottle that, you get like 5-hour energies at like gas stations, so like it's like an energy drink. The other common thing is it's like in a packet in a powder form, and they like mix it with some, some drink. Yeah.
I've never heard of that before.
Yeah, it's seems it wasn't, overdoses on kratom weren't very common until recently. They're concentrating it more and more, and it's becoming more of an issue. It's definitely more prevalent on the East Coast, but it seems like it's moving its way this way.
And you said they sell it at smoke shops?
Gas station.
Yeah, gas stations, liquor stores, yeah.
Yeah, so we recently were meeting with some other prevention providers throughout the county, and one of them was talking about how they saw that they were mixing it with marijuana as well. And so, polysubstance use is never a good thing, and or dual substance use. And then sometimes the policies that we work on in the county sometimes will be like the placement of those products. Because I know we have a smoke shop, we have a liquor store up in Big Bear specifically where, those particular products are right there on the counter. They're bright colored, any child can grab it and purchase it. And so that's some of the things that we like to work on as well, is like the placement of those products and making sure that they're not near things that kids could potentially purchase as well, or like that where they would be tempted by that. So those are some of our efforts too for prevention.
It's considered legal.
Yes.
Currently, I think legislators are working on, changing that.
Any other questions? I hear the crickets. Was there any additional things you guys would like to add before we wrap up this evening? Oh, Raquel would like to say something.
I have a 45-minute slideshow presentation that is very informative, and I think it would be very appropriate for children. If anybody knows a classroom or a setting where there's children that would like me to show them the presentation.
So in case you didn't hear, maybe those that are watching online, you're talking about the naloxone presentations, is that correct? Yeah, so through Green Family Services, we have an amazing program where we offer naloxone presentations for the community. We also hand out those the naloxone as well for free. So any organization, maybe you have staff that you work with where you're in the community often, or just because maybe you have a family member, or like Michael mentioned, sometimes if you're an older person or anybody that has to take lots of medication, sometimes we forget. And so there might be a moment in which you accidentally overtake this medication. And so, Raquel is one of our community health workers, and she's incredible. And so she can come and do a quick presentation with you guys to teach you a little bit of background on opioids, and then of course how to use naloxone as well. So please let us know. You can also email that rcfycoalition@greenfamilyservices.org to set that up, or come find us. Yes.
Just to kind of piggyback off of the kratom and how it's in the brightly colored packages and just kind of out there for purchase. What about also the uptick in seeing like legalized mushroom products that do have psychedelic properties that are available legally, as well as the legalized like the Delta 8s and the Delta 9s, those items that you can find just in a little shop, even in areas that are technically supposed to be illegal to sell in any cannabis, in the unincorporated areas of San Bernardino County. Can you speak to that?
So I think, the fact that our, third highest pediatric, ER, drug visit thing is hallucinogens speaks to the fact that those legalized mushroom products are becoming more prevalent, in our society. As far as the kind of fake marijuana, products, I don't feel like I see a lot of that in our ER. And I don't know if that's because, marijuana is legal in California now, and so, it's not as compelling of a purchase for folks anymore. But definitely the legalized hallucinogens do seem to be becoming more prevalent.
Any more questions? All right, well, we thank you so much for coming out tonight, and for those of you that are watching online, and thank you so much for being here for our amazing panel. And yeah, we hope you guys will consider being a part of the solution with Rim Communities for Youth Coalition. If you can't join the coalition, at least fill out a survey. No. All right, have a wonderful evening, everybody. Thank you.